This video is about a patient treated with CARVYKTI, ciltacabtagene autoleuce. Individual results may vary. Please see the full important safety information in this video and the full prescribing information and medication guide at CARVYKTI.com. Discuss any questions you have with your doctor. What is CARVYKTI, ciltacabtagene autoleuce? CARVYKTI is a treatment used for adult patients who have cancer of the bone marrow, called multiple myeloma. It is used when at least one other treatment has not worked or has stopped working. CARVYKTI is a medicine made from your own white blood cells, which have been changed, genetically modified, to recognize and attack your multiple myeloma cells. Important safety information. What is the most important information I should know about CARVYKTI? CARVYKTI may cause side effects that are severe or life-threatening and can lead to death. Call your healthcare provider or get emergency help right away if you get any of the following: fever, 100.4 degrees Fahrenheit, 38 degrees Celsius or higher; chills or shaking chills; fast or irregular heartbeat; difficulty breathing; very low blood pressure; dizziness or lightheadedness; persistent or severe diarrhea, abdominal pain, and weight loss. Effects on your nervous system, some of which can occur days or weeks after you receive the infusion and may initially be subtle, such as feeling confused, less alert or disoriented, having difficulty speaking or slurred speech, having difficulty reading, writing, and understanding words, memory loss, loss of coordination affecting movement and balance, slower movements, changes in handwriting, personality changes including a reduced ability to express emotions, being less talkative, disinterested in activities, and reduced facial expression, tingling, numbness and pain of hands and feet, difficulty walking, leg and/or arm weakness, and difficulty breathing, facial numbness, difficulty moving muscles of face and eyes. It is important that you tell your healthcare providers that you have received CARVYKTI and to show them your CARVYKTI patient wallet card. Your healthcare providers may give you other medicines to treat your side effects.
My name's Mary. I'm from Rapid City, South Dakota, and wanted to participate today to share our experience with CARVYKTI. Being Tony's partner and hearing the diagnosis of multiple myeloma, it was very scary. It was a lot to take in. We had a lot to learn. We had a lot to just absorb at that time.
My treatment journey started, of course, almost immediately after my diagnosis. Having support, any type of support is great, but having the immediate family available is a blessing. With Mary, she seems to always give 99% or 100% all the time.
It is definitely a wide range of emotions in the beginning. I think it took me a little while to feel some of those, though, to be honest with you. In the beginning, I was the master information gatherer, I was the note taker, I was the task doer. There's so many appointments to go to, there's so many things that have to be done, and so much to do. I mean, there's just the busyness of learning the medications, the busyness of getting used to this new life. Tony's cancer started progressing. We booked a trip to New York to see a Yankees game, which marked a bucket list off, and the whole family was gonna go. And 2 weeks after that, we got a call saying there was a slot open for CARVYKTI. And the doctor said, you need to cancel your trip.
I had to be in Rochester, I believe, within a week to find somebody to go with, transportation, lodging, even meals, everything that came about. So with Mary, my wife, that very fortunate that her workplace was phenomenal. They gave her the time that she needed. And within that short time frame, that allowed her to not only transport me, but also to be with me and provide as a care provider. And also too with my son, my oldest son, spent a week with me in Rochester when I started the tests.
My experience as Tony went through CARVYKTI was wondering what was going to happen next a little bit, knowing the side effects that could happen and kind of waiting for them. They count the days, right? This day, if you're going to have a side effect, it could happen by this day. So you kind of sit with anticipation and you're waiting and you're going to the appointments, the daily check-ins, and you come back and you do the vitals, and keep track of those things in between the daily checkups. I'm really good at suggesting to other people to take care of themselves and to do things for themselves. I'm not as good at doing that for myself. When speaking to people who are looking at going through this process, I encourage you to educate yourself with your team, educate yourself with the support that you have available to you. Be best friends with the social worker. They know a lot of resources available. They may have a caregiver support group available to you. Find one, join it. It does help. Take care of yourself. Use your family, use your friends, let them help you. When they're offering help, say yes. It's okay. It's okay to say yes.
My wife's Mary, and she's a phenomenal lady. In fact, I hope when I grow up I can be like her. And as far as that, I'm very blessed today. So I was fortunate with CARVYKTI and coming to this program. The thing I realize now and ever more is that I'm not alone, only if I allow myself to be.
CARVYKTI gave us hope, and we're really thankful for that.
What is CARVYKTI? Ciltacabtagene autoleuce. CARVYKTI is a treatment used for adult patients who have cancer of the bone marrow called multiple myeloma. It is used when at least one other treatment has not worked or has stopped working. CARVYKTI is a medicine made from your own white blood cells, which have been changed, genetically modified, to recognize and attack your multiple myeloma cells. Important safety information. What is the most important information I should know about CARVYKTI? CARVYKTI may cause side effects that are severe or life-threatening and can lead to death. Call your healthcare provider or get emergency help right away if you get any of the following: fever, 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills or shaking chills, fast or irregular heartbeat, difficulty breathing, very low blood pressure, dizziness, lightheadedness, persistent or severe diarrhea, abdominal pain, and weight loss. Effects on your nervous system, some of which can occur days or weeks after you receive the infusion, and may initially be subtle, such as feeling confused, less alert, or disoriented, having difficulty speaking or slurred speech, having difficulty reading, writing, and understanding words, memory loss, loss of coordination affecting movement and balance, slower movements, changes in handwriting, personality changes, including a reduced ability to express emotions, being less talkative, disinterested in activities, and reduced facial expression, tingling, numbness, and pain of the hands and feet, difficulty walking, leg and/or arm weakness, and difficulty breathing, facial numbness, difficulty moving muscles of face and eyes. It is important that you tell your healthcare providers that you have received CARVYKTI and to show them your CARVYKTI patient wallet card. Your healthcare providers may give you other medicines to treat your side effects. Before you receive CARVYKTI, tell your healthcare provider about all your medical conditions, including if you have current or past neurologic problems, such as seizures, stroke, new or worsening memory loss, lung or breathing problems, heart problems, liver problems, kidney problems, a recent or active infection, low blood counts. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How will I receive CARVYKTI? CARVYKTI is made from your own white blood cells, so your blood will be collected by a process called leukapheresis. The procedure can take 3 to 6 hours and may need to be repeated. Your white blood cells are sent to a manufacturing center to make CARVYKTI. It takes about 4 to 5 weeks from the time your cells are received at the manufacturing site and are available to be shipped back to your healthcare provider, but the time may vary. While CARVYKTI is being made, you may get other medicines to treat the multiple myeloma. This is so your multiple myeloma does not get worse. Before you get CARVYKTI, your healthcare provider will give you chemotherapy for 3 days to prepare your body. 30 to 60 minutes before you are given CARVYKTI, you may be given other medicines. These may include medicines for an allergic reaction, antihistamines, medicines for fever, such as acetaminophen. When your CARVYKTI is ready, your healthcare provider will give CARVYKTI to you through a catheter, tube, placed into your vein, intravenous infusion. Your dose of CARVYKTI will be given in one infusion bag. The infusion usually takes approximately 30 to 60 minutes. After getting CARVYKTI, you will be monitored at the certified healthcare facility where you received your treatment for at least 7 days after the infusion. You should plan to stay close to the location where you received your treatment for at least 2 weeks. Your healthcare provider will check to see that your treatment is working and help you with any side effects that may occur. You may be hospitalized if you develop serious side effects until your side effects are under control and it is safe for you to leave the hospital. Your healthcare provider will want to do blood tests to follow your progress. It is important that you have your blood tested. If you miss an appointment, call your healthcare provider as soon as possible to reschedule. What should I avoid after receiving CARVYKTI? Avoid driving for at least 2 weeks after you get CARVYKTI. You must not be given certain vaccines called live vaccines for some time before and after CARVYKTI treatment. Talk to your healthcare provider if you need to have any vaccinations. Do not donate blood, organs, tissues, or cells for transplantation. What are the possible or reasonably likely side effects of CARVYKTI? The most common side effects of CARVYKTI include fever, 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, chills, dizziness, lightheadedness, headache, muscle or joint pain, feeling very tired, altered mental state, confusion, infections, low levels of antibodies, immunoglobulins in the blood, cough, being short of breath, diarrhea, nausea, decreased appetite, constipation, fast or irregular heartbeat, problems with blood clotting. In a study comparing CARVYKTI to standard therapy, there was a higher rate of death in the first 10 months in the CARVYKTI arm, 14%, compared to the standard therapy arm, 12%. The increased rate of deaths occurred before receiving CARVYKTI and after treatment with CARVYKTI. The reasons for death were progression of multiple myeloma and side effects of the treatment. CARVYKTI can cause a very common side effect called cytokine release syndrome, or CRS, which can be severe or fatal. Symptoms of CRS include fever, difficulty breathing, dizziness or lightheadedness, nausea, headache, fast heartbeat, low blood pressure, or fatigue. Tell your healthcare provider right away if you develop fever or any of these other symptoms after receiving CARVYKTI. CARVYKTI can increase the risk of life-threatening infections, including COVID-19, that may lead to death. Tell your healthcare provider right away if you develop fever, chills, or any signs or symptoms of an infection. CARVYKTI can cause various neurologic side effects, some of which may be severe or fatal. Symptoms include, but are not limited to, confusion, disorientation, loss of consciousness, seizures, difficulty speaking, reading, or writing, tremor, slower movements, changes in personality, depression, tingling and numbness of hands and feet, leg and arm weakness, and facial numbness. CARVYKTI can lower one or more types of your blood cells, red blood cells, white blood cells, or platelets, cells that help blood to clot, which may make you feel weak or tired, or increase your risk of severe infection or bleeding that may lead to death. After treatment, your healthcare provider will test your blood to check for this. Tell your healthcare provider right away if you get a fever, chills, or any signs or symptoms of an infection, are feeling tired, or have bruising or bleeding. CARVYKTI can cause serious gastrointestinal side effects, including severe or persistent diarrhea or ruptured bowel, which can be life-threatening and may lead to death. Tell your healthcare provider right away if you develop diarrhea, abdominal pain, weight loss, fever, chills, or any signs or symptoms of an infection. CARVYKTI may increase your risk of getting cancers, including certain types of blood cancers. Your healthcare provider should monitor you for this. Having CARVYKTI in your blood may cause some commercial human immunodeficiency virus HIV tests to incorrectly give you an HIV-positive result, even though you may be HIV negative. These are not all the possible side effects of CARVYKTI. Call your healthcare provider if you have any side effects. You may report side effects to FDA at 1-800-FDA-1088. Please read full prescribing information, including boxed warning, for CARVYKTI.